I'm Dr. Ned Lattime. I'm the Deputy Director of the Cancer Institute of New Jersey and a Professor of Surgery at the Robert Wood Johnson Medical School. I'll be presenting at University for a day work that we've done in the area of cancer, vaccines, and immunity. Most tumors are normal tissues that have one or two small genetic changes, and therefore the difference between the tumor and oneself is minor. So we had thought for a long time, and the field had thought for a long time, that if we could generate an appropriate vaccine that would heighten the ability to see the genetic changes associated with tumors, that one would then develop an immune response that would be every bit as effective as a vaccine against the measles or the mumps. We expected that the tumor was sitting there as a bystander, waiting for an immune response to see it. What we now know is tumors have developed very sophisticated ways of actively evading the immune response. We're actually trying to identify in the laboratory the mechanisms by which the tumors escape the immune response. And what we and other people in the field have found is that it's not one or two, it's a half a dozen or more. And the farther we look, the more we see. What our lab was one of the first to find was solid tumors, and we started with melanoma and bladder cancer, that were making a protein, a factor, whose only role is in modulating the immune response, in reducing the immune response. In the last year, there have been 2 immune active agents approved by the FDA, and they're the first 2 that have been approved. One is a vaccine for prostate cancer that has been shown to be effective in patients with advanced disease. And the other agent is not a vaccine, but it's an antibody that actually shuts off or blocks one of these immune escape mechanisms that I talked about. We actually demonstrated that if we provided the vaccine at the tumor site, which goes against all other studies where one wants to give the vaccine as far away from the tumor as possible. If we gave the vaccine at the tumor site, we could specifically overcome one of the most potent inhibitors of the immune response. And that finding has now led to a clinical trial in pancreas cancer that's ongoing here at the Cancer Institute of New Jersey. UMDNJ's very first University for a Day will be October 22nd in New Brunswick. You can register online, and we hope to see you there.